Hi, I'm Tony. I'm going to talk about a healthcare solution that our country can utilize to help deal with the healthcare crisis that's going on in America today. As we know, healthcare has many problems at many different levels, um, but something you don't hear too much about is Medicaid itself. You hear a lot about Medicare reform. You hear about cost control, prescription drugs, healthcare spending, things like that. But you don't hear too much about Medicaid, and I think a lot of that has to do with the fact that we're dealing with poor people, which is a very sensitive subject for many people. It's very polarizing, very political, so I'm not going to touch on the politics of it. I'm just going to stay with the economic logic and let that kind of speak for itself. Two of the problems that I have with Medicaid are, one, the overutilization, and two, the fraud and the abuse that's going on with it. It just runs rampant. In 1990, Medicaid enrollment was 25 million people. In 2009, Medicaid enrollment skyrocketed to 64 million people. That's a big part of why Medicaid's under the financial problems that they're having right now. During this time, though, a company called RAND, R-A-N-D Corporation, did a health insurance experiment in which they provided a case study showing how comprehensive or universal type health insurance plans actually led to an overutilization of healthcare services. This resulted in a healthcare inflation or a rise in healthcare costs, but yet it did not yield a better health benefit than people that have private insurance. And then, as far as fraud goes, Malcolm Sparrow is a Harvard University expert on healthcare fraud, and he did a study, and what he found was that approximately 20% of the cost of these federal healthcare programs, which is about $60 billion, came from Medicaid waste and improper payments. So those are two big reasons why I don't like the Medicaid program the way it is. One solution would be to do something like convert Medicaid over to a consumer-driven voucher program, much like the Housing and Urban Development Department has for housing funds, where they give housing vouchers for people who are low income. A benefit to the beneficiaries would be, one, they get to choose which health insurance, they get to choose deductibles, they get to choose the benefits of the insurance plan. This would also allow them to choose what doctors they go to. Another benefit is if they do not qualify for the program any longer, then they're still able to keep this program, keep the health insurance plan. If they get better jobs or make more money, or if they become not eligible for the program, and in that time they've incurred an uninsurable condition, then they're not going to be kicked off of the health insurance plan. They're able to keep that health insurance plan because they've already proven their insurability at an earlier point. A benefit to the providers, the hospitals and the physicians, is that many times health insurance companies pay better than do government programs. When you have more people into these more participants in this pool of people, and everybody's paying in a little something, now the physicians in the hospitals can actually lower their prices for the people that are paying things on a cash basis, or they can actually lower their cost of services and procedures that are being done. So those are just a couple of benefits that I see in doing a voucher program. There's many more. You can Google Medicaid vouchers. I'm not knocking on the poor. I was poor at one time. I was actually, my family was on Medicaid and welfare, so I've been there. But I worked hard to try to get to where I am and didn't settle for that. So I think if we can try to incentivize people to help motivate them to be more self-sufficient, I think that'll be a big part to the healthcare, solving the healthcare crisis. Thanks.